Hello, my name is Tanya Henschel. I've been married to George for 14 years and we have two beautiful children, Caitlin 9 and Brady 6. I would like to take this opportunity to inform you about a disease called cystic fibrosis. Cystic fibrosis is a fatal genetic disease that affects many systems of the body, primarily the lungs and digestive system. Thick mucus builds up in both the lungs and digestive system, causing problems for the patient. Many lung infections are due to the mucus buildup, which can cause permanent lung damage. Early symptoms of cystic fibrosis are: patients with cystic fibrosis spill salt. Therefore, when they sweat and you kiss them, you are able to taste salt on their body. Patients can require up to 5 times the normal amount of salt that we do in a day. If a patient does not replace the salt needed in their body, they may have dehydration or extreme tiredness. Frequent or persistent cough is also another sign. Patients with cystic fibrosis are encouraged to cough. They need to get the mucus from their body, therefore coughing helps get the mucus out. Persistent respiratory infections may occur if a patient is not doing their treatment, or if a patient is exposed to illnesses, or a buildup of mucus is in their lungs. Patients may have more respiratory infections. Patients also have large, clay-like, greasy stools because of the lack of absorption from food. Mucus builds up in the digestive system and does not properly allow food to digest. Patients also have failure to thrive because they do not digest their food. This can set children back in their growth. Patients also have a large appetite or a lack of appetite because of the lack of absorption of food. They may require more food to meet their nutritional well-being. Some common facts of cystic fibrosis are: it affects 1 in 2,000 births. Average life expectancy is 37 years of age, but because of new advances in medication, patients are living in their 40s, 50s, and even 60s. Patients with cystic fibrosis are also more prone to infections. They need to be careful of the illnesses that they are exposed to, such as the common cold, where we as normal people can take over-the-counter medication. Patients with cystic fibrosis cannot take coughing suppressants. They need to be encouraged to cough. Therefore, they may end up in the hospital with their illnesses. And unfortunately, at this time, there is no cure for cystic fibrosis. How CF is treated. Strict attention is paid to the growth and well-being of children. Pancreatic enzymes are used to help patients break down their food and digest it. When a patient is going to eat, they need to take medications that help their food break down. If a patient does not take these pancreatic enzymes before eating, they may have more spills or more diarrhea and not able to grow from their food absorption. Also, respiratory therapy is very important to help clear secretion from the lungs. A nebulizer is used for a patient to inhale the medication into their lungs. Patients put the medication into the nebulizer, turn the machine on, and breathe. Breathe in the air as much as they can. This helps loosen the secretion from their lungs and allows the patient to spit the mucus out. Also, patients with cystic fibrosis may use chest therapy vest. A patient simply puts on the therapy vest and turns the machine on. This helps to vibrate the lungs and allow the mucus to loosen up so the patient can spit the mucus out. Another form is the flutter. When a patient is not able to use the chest therapy vest, they use the flutter. They simply breathe into the flutter, which vibrates the lungs, and it also helps them expel the mucus from their lungs. These two therapies are in place of the hand percussion that used to be used, where they used to cup their hand and beat the lungs to help break up the mucus. This use of a therapy vest is a new way to help patients become more independent and able to clear the mucus from their chest themselves. Another part of everyday life with cystic fibrosis is medications. Many medications may be used on a daily basis to help patients thrive. Different medications to help with digestive needs or to help fight off lung infections. This is an everyday part of their lives and must be taken on a daily basis. The key to long-term survival: the use of aggressive treatment of both nutritional deficiencies and bacteria infections. Treatment is an ongoing process and must be done on a daily basis. Even when a patient is feeling well, they must do the regimen of medication and respiratory therapies on a daily basis. The emphasis is on maintaining optimal health and preventing any complications that the disease may cause. Some myths or misconceptions about cystic fibrosis is: cystic fibrosis is not contagious. The only way to get cystic fibrosis is to be born with cystic fibrosis. It also does not affect the mental or intelligence of a child. Children with cystic fibrosis do not have to live in a bubble. They are encouraged to live normal lives. They are not to be treated as invalids and encouraged to be as independent as possible and learn how to treat their life with cystic fibrosis. I would like to take this opportunity to tell you why I am so passionate about cystic fibrosis. This is a picture of my daughter, Caitlin. She is 9 years old. She was diagnosed with cystic fibrosis 2 weeks after birth. Caitlin came 6 weeks early due to severe problems with her digestive system. She had a majority of her bowels removed after birth. She was life-flighted to Geisinger Medical Center in Danville, where she spent the first 3 months of her life in the NICU. To date, Caitlin has had 15 surgeries and many hospital stays. She is followed closely by a pulmonologist who specializes in cystic fibrosis. Our family is very passionate about spreading the word of cystic fibrosis in order to inform other families of knowledge and how to treat the disease. I would like to thank you for taking this chance to learn more about cystic fibrosis. If you have any questions or would like to learn more, I invite you to visit the Pennsylvania Cystic Fibrosis Incorporated website. Thank you.